I'm a registered nurse since 1997 with a clinical background from a neurosurgical ward and as a contact nurse in a neuro-oncology team at Karolinska University Hospital in Sweden. I did my master in nursing science and just finished my PhD studies with a focus on person-centered care and how this can be measured. Right now, I'm working at the Regional Cancer Center in Stockholm with patient-reported measures in different projects and national registries. My presentation will briefly introduce you to nursing in neuro-oncology. In relation to this presentation, I declare that there are no conflict of interests. In Sweden, the nursing education is a 3-year full-time program that leads to a Bachelor of Science degree in nursing. Thereafter, there are several postgraduate programs for a Master of Science with a specialization in a certain area of expertise, such as oncology, surgery, neurology, or palliative care. There are also separate courses such as for contact nurses, caring for people with cancer. We have 7 neurosurgery clinics covering the 6 regions in Sweden. All larger university hospitals have neuro-oncology teams, and all patients are diagnosed via multidisciplinary conferences. There are national guidelines and a national quality registry for tumors in the central nervous system. And we have a good collaboration with the Swedish Brain Tumor Association, who is involved in different of our working groups. Nurses within neuro-oncology are found in many different specialities and are important as a brain tumor diagnosis presents unique challenges for both patients and their family members. A brain tumor is often discovered after a sudden acute event, such as a seizure, cognitive or personality changes, or other neurologic or stroke-like symptoms. After a confirmed brain malignancy diagnosis, patients may be admitted emergently or within 2 weeks for surgery and then discharged to a rehabilitation facility or home. Depending on pathology, patients' wishes and performance status, patients continue on a path towards additional oncology treatment and rehabilitation. As the disease proceeds, home care and palliative care teams are often involved. In Sweden, we have a nursing role similar to navigator nurses as they have in the US or as in UK, Macmillan nurses. Every patient is offered a named contact nurse, and these contact nurses are also equally offered to family caregivers or close friends and are part of the neuro-oncology team. The contact nurses, the patient should have special access, and the contact nurse can refer to other contacts also when not available. They should inform about the next step so the patients always know what to do or what's happening next. They also provide support to both patient and family and close friends in normal crisis reactions. They also encourage patient and caregivers' participation and influence in their care. And they are also responsible to establish an individual care plan and also for active handovers to any new contact nurse in the continuum of care. Patients with neuro-oncology conditions are unique regarding the physical and cognitive side effects and also the potentially terminal diagnosis. A person-centered approach means that healthcare professionals, patients, and family caregivers co-create their care. And the aim is to find a common ground and understanding to create a personalized health plan. The Swedish National Cancer Plan states that patients should be offered both oral and written information regarding treatment and care, including survivorship care planning and rehabilitation in a care plan. The care plan that we use is developed by a group of contact nurses and patients from the Swedish Brain Tumor Association, and the care plan is initiated at diagnosis and are adapted to the patient by the contact nurse. The care plan should include contact information, time schedule and information of the medical procedures and treatments, survivorship care and the rehabilitation plan, and self-management advice for the patient. To support communication, there are also a chat or email function and a toolbox of questionnaires to use for holistic needs assessments and symptom management. The care plan is available on paper or as a web solution. The needs of brain tumor patients differ from those of other cancer patients, and their needs are often unmet by existing resources. Therefore, person-centered care and continuity is of importance. Person-centered care means involvement of both patients and people important to them, both formal and informal caregivers, to ensure the patient and family has the best support available for them. During the path, having the right care at the right time is of importance and something the contact nurse and the rest of the neuro-oncology team are looking for. The importance of involvement of family, friends, is also because of they are the best support for the patient. And they also the ones who support the patients in daily life. Another thing that is very important when you meet the patient is that they really want to know what they can do themselves. So self-management advice, how to do their own rehabilitation, if they want to eat something particular, and everything that you can listen from the patient is of importance and should be part of the plan. All this is due to the quality of life of the patients. I wrote continuity as an important thing in neuro-oncology care because I think these people need special treatment all the way, and continuity can support them to have someone they can access all the time. Another issue that is of importance is safety. To be sure that the patient can actually take the medicine that they should, or they take the medications as they can, you need to maybe sometimes involve both caregivers and home care facilities. Another thing about safety is the transportation. Many people with malignant brain tumors are not allowed to drive their own car, and therefore they need help from family and friends. Another best of support could be peer patients, and the patient association in Sweden are very eager to be involved to support these patients also. Some people want to meet peer patients, but some people just wants to read what other people have been involved in or their treat. This quotation is from a friend of mine and shows the importance of having a contact nurse or someone else during the care path. The contact nurse, their role in cancer care can't be stressed enough. They helped us throughout so many of those steps, and they gave an immense sense of security. We could call them and they gave us answers. They asked a bit about how you were doing, gave you a warm tap on the shoulder, and it became a little bit of a family. Otherwise, you're pretty much left on your own. Thank you for listening, and please feel free to contact me if you have any questions.